I'll fix it after. Okay.
Thank you so much.
Really just the review questions?
Yeah.
Okay.
Welcome, thank you for coming. All right, so here's the plan. A couple announcements. First of all, I got all your PICO's assignments graded. They're all in Blackboard. You like how quickly I get those back to you? So take my feedback on those, please. Okay, I saw a lot of really great PICO scenarios. What we're going to do is, and my goal in this class is we try to kind of build on everything. All right, so there's really no busy work. Everything has a purpose. So now what we're going to do is we're going to take those PICO, all right, we're going to take the therapy and the qualitative, and now you're just going to copy and paste, and you're going to use that for your search assignment. Okay? I'll talk more about that next week. And then from your search assignment, you're going to take your therapy and then use that for your poster presentation. So by the time you get to your poster presentation, you probably got 70% of that done. Okay? All you really have to do is create some PowerPoint slides, put them on a board, and you're good to go. Okay? We'll talk more about that as we go. Quiz 2, the average was like 82.6, so it dropped a little bit. I'm not sure why. But what I would say is pay very close attention to what we're highlighting in class, right? Important points. Because I know what's on the quiz, so I'm trying to make sure you understand those important topics. All right, any questions, comments, or concerns? Everybody good? All right, so plan for today, brief lecture on qualitative methods, and then we're going to close out qualitative. And then we're going to do the in-class group qualitative assignment, which is 7.5% of your grade. Done, put it behind you. And then we're going to spend the rest of the course working on qualitative stuff, the stuff Corey loves. All right?
You know what? I kind of like the paper I read.
Really?
Yeah.
All right. All right. Okay, so that's our plan. Katrina is going to be presenting your lecture today. So, yeah, she's very excited. All right.
All right.
Why don't you take it away?
So yeah, again, my name's Katrina. I'm excited, but a little nervous because this is my first college lecture ever. And we are going to talk about qualitative research today. I definitely have notes because lots of this is new to me. I've learned about it a lot over the last few years of graduate school, but definitely I wouldn't call myself an expert on it. So Chris is going to maybe possibly jump in when I have if I stumble, okay? But Chris is handing out, one of the things I had to do in my graduate program is to develop a teaching strategy. And one of the most important things our job as nurse educators is to get you guys to pass the NCLEX. And so you have to get used to answering those NCLEX style questions. So this is just a 1-minute activity that I came up with that I plan to implement in my future classroom called the question of the day. So handing out a question of the day, you're just going to don't ask your neighbor, I'd like everyone to do it independently, and just take a minute to answer the question of the day. So this is an NCLEX style question, although there might not be a lot of best practice on NCLEX, but just take a minute to fill that out, and then at the end of the class, we're going to review it together. And over the course of the next 40 minutes or so, hopefully you'll have learned all about those things. And if you don't have the answer now, you'll have them in 40 minutes, okay? So in our last class, we discussed completing literature searches. And like I said, we're talking about qualitative research today. So which 2 databases would you begin with if you want to find some qualitative research studies? CINAHL. I think I hear tiny whispers of it. PubMed, yes. Those are the two databases that you are going to focus on. So we're going to start at the beginning. What is qualitative research? So qualitative research is explanatory, descriptive, and inductive in nature. It uses words opposed to numbers to explain phenomena. And phenomena are those things that are perceived by our senses. So pain or losing a loved one. We are able to see the world through the eyes of another person. For example, as relating to pain, we all experience that differently. So one person might experience great pain, or it may be a 10 in the scale if they weren't able to participate in sports. They were able to do everyday life, but not participate in sports. So that might be devastating to them. Whereas to another person, if they lost the ability to go to the grocery store or just complete simple ADLs, that would be a different perception of that. So we have to remember that everyone's values and perceptions are different to the phenomenon that you're studying. Qualitative research occurs out in natural settings, such as in a person's home or where they are functioning. And this allows the researcher to get an idea of the environment that the participant is living in, living in. Through qualitative research, we can try to understand a culture, understand their lived experience, the meaning, and how they cope with various things. So qualitative research is inductive in nature, meaning the reasoning goes from specific to general. And in deductive reasoning, it's the opposite. So moving from general to specific. This graphic shows some examples. Deductive, an example of that is, I don't think this one's on there, but all men are mortal. Harold is a man, therefore Harold is mortal. Again, deductive is quantitative in nature. For inductive, the first coin I pull from the bag is a penny. A second coin I pull from the bag is a penny. I keep pulling pennies from the bag. Therefore, all the coins in the bag are pennies. And that would be qualitative in nature. So here's a quick compare and contrast of qualitative and quantitative research. A way I remember this is that as a nurse, I complete both subjective and objective assessments on my patients. When they are describing how they feel or their chief complaints, that is all objective data. I often use their direct quotes when writing a progress note. So I get into my Epic, I'm typing out my progress note, and I will literally put in quotes, "My pain is not too bad for me to sleep." I work in the PACU, so I talk about people's perception of pain a lot. So now, when I complete their objective assessments, I'm looking at those hard numbers again. What is their blood pressure? What is their temperature? What is their heart rate? There's no variance of that. A machine is telling me what their hard data number is. In qualitative research, the researcher wants to identify common themes among the participants. These themes are the data, and they are represented by words and descriptions. Researchers use direct quotes from the participants. So QR, or qualitative research, gives us the answers to those difficult why questions that we have. We are seeking to understand the lived experiences of the research participant. They help us understand the lived experience, their perceptions, their coping, and their meaning. We assigned 4 qualitative articles for you to read, again, and those were teen dating violence, parental presence during resuscitation, experiences of mothers of infants of neonatal abstinence syndrome, and end-of-life experiences from bereaved parents. So again, those are all, we're trying to identify and understand what all those individuals were feeling through various live experiences. So next slide, sampling. Sampling, much different than in quantitative. We are using a smaller sample size. So usually 6 to 10 participants, definitely less than 30. So for example, the parents who have lost a child, or we're using a purposive sampling method, which means researchers are seeking out parents who've had that experience. So you can't just randomly pick people. You have to select people that have had that experience happen to them. Data interpretation starts while you are interviewing the participants. And data collection occurs simultaneously with data interpretation. So with quantitative, most of the time you're collecting all the data and then you're looking at it at the end. Whereas in qualitative, as you're researching and you're interviewing those participants, you're kind of taking that all in and letting that develop. The researcher is going to identify their themes. After 10 or 12 participants and they've interviewed and they're not establishing any new information, they're going to call it data saturation has been met, meaning they're hearing the same thing over and over. They're not getting any new information from the participants. And when that happens, you can say that that's a large enough sample. So I just wrote down some of the samples for those 4 articles. So in the neonatal abstinence syndrome, I went through that article. It looked like they had 15 Hispanic substance-addicted mothers. Teen dating violence article, 26 young mothers. The bereaved parents article had 6, and then the resuscitation had 14 parents of critically ill children that either survived or died following resuscitation. So again, those are much smaller sample sizes compared to quantitative research studies. So again, we're going to talk about purposive sampling. So if my population is nurses, I'm going to purposely look to recruit nurses into my study. Next definition is snowball sampling. So that's by word of mouth. If you have trouble recruiting more participants, you're going to ask active participants, hey, do you know someone that this has also happened to them? Maybe you've met them in a support group or at the hospital when they've been dealing with that issue or out in the community. So you pretty much get your new participants from previous. And in quantitative research, there is not a predetermined number of participants to be selected. If you happen to see and you're reading through your research article and you see a power analysis listed, where typically a good power analysis is 80%, yes. So if you see a power analysis listed in your research article, you do not have a qualitative research article. That is a quantitative. So that is a key indicator of you have the wrong type of article, okay? So most of the time, qualitative research is completed through interviewing. Interviews can be individual or in a small group called a focus group. Voice recorders are typically used to allow for verbatim transcription to be written up for a review. Potentially some observations like participants completing daily tasks can occur for direct observation. And then the last source would be artifacts. So if you were going to look through old data, look through previous journals or old records. So for the researcher, it's very important to take field notes. The data collected, again, are expressed in words. Not just what the people say, though. You should also include the setting and the mood of the participants. You should immerse yourself in the environment. The text noted how qualitative researchers use more flexible procedures than quantitative researchers. While collecting data for a project, they consider all of the experiences that are to occur. Chris is my...
Methodological.
Yes, methodological logs. And that is a change in questions asked along the way. So if you're keeping a record, you can see if your research question or things are evolving or if you need to adjust the study. Is that how you would say it?
Yeah, but it's more about consistency.
Consistency.
So making sure that you've got an audit trail of all the changes that you've made.
Okay. Qualitative research is very subjective. Keeping data logs helps limit bias. You know, if you read things back, you can notice if you're writing down things that are more personal to you, opposed to what you may have actually witnessed or heard. In the methods section, if you see that they did field notes, a methodological log, reflective journals, those are all good things. There's more confidence in the results, and it establishes credibility of the study. And for data collection, this is pretty much just straightforward. Per the participant observation, researcher is not only an observer, but is also a participant during data collection. And I already mentioned artifacts before, so looking through old records, books, mementos. Again, you're going to collect those words. Those words are what are going to develop your themes. You can collect them through questionnaires, interviews, through focus groups, case studies, direct observations. So if you were to get a questionnaire, you can do that by mail, internet, read by the data collector. You don't have to be in person to do that. A lot of questions or surveys are now also done through like SurveyMonkey and various internet programs. If you mail them, a disadvantage is that you can't ask participants to clarify their responses and you can't verify the authenticity of their response. Someone other than the intended recipient could be filling it out. So also sometimes you might be putting down what the other person wants to hear. that can be true, you know, especially if you're giving demographic. If you get a survey in the mail and you want them to think really good things about you, you know, you may not be exactly truthful in the questionnaire. Advantages, again, easy to administer. They can provide a lot of information. They're inexpensive. So interviews. Seen most often with focus groups. Interviews and focus groups are usually tape recorded and, again, transcribed verbatim. It's not good to try and remember what the participants said, so it's good if the researchers record all the data. You should use structured interviews with specific lists of questions asked of each participant. And you don't modify those questions. You stick to the script at hand. This limits a researcher bias. The downside is if a good topic comes up that you want to explore, you're kind of locked into what that structured interview question set is. Now, if you followed an unstructured path or unstructured interview, that is open-ended and it requires a lot of skill for the researcher. And the researcher probably needs to have undergone very special training to be able to navigate the conversations to limit bias. And again, interviews are usually open-ended, unstructured. Ensure you're in a quiet place, in their natural setting. 30 to 90 minutes, audio, video. Kind of talked about these things already. So a focus group, if the focus group is too big, it's going to be difficult to manage the group. Someone who likes to talk a lot can go off on a tangent. So it really requires a skilled facilitator to redirect the group and keep them on task. Also, some participants or people may not feel comfortable to participate in a focus group. So that is a disadvantage. So case studies, they are used for rare events or a rare phenomenon, and they may only target 1 or 2 people. They could be used for quality improvement projects or initiatives in hospitals or during grand rounds. Lots of times when there's sentinel events or things like that, you'll see them. I know that we'll get invitations to come to a grand rounds because they're going to have this case study on this event that happened, and something to learn from is pretty much what they use that for. If that situation were to occur again, how could we handle the situation differently, and what have we learned from it? If a researcher is present, they are a participant observer. It's important to have more than one person doing the observation to ensure inter-rater reliability, meaning that both researchers are seeing the same thing. So we eventually, after the next step is to analyze and interpret the data. So this involves descriptions, data reduction, analysis, and interpretation. You're going to reduce the data down to meaningful parts. So you're going to select, focus on those key terms, and develop those themes. Direct quotes also help support the study findings. So if you have a direct quote that supports a specific theme, you should include that in your data analysis. Data reduction is reduce data down to meaningful parts. You're going to select, focus, and simplify the data from field notes and or transcripts. Exclamation point, this is going to be on the quiz. Want me to say it one more time? Yeah. Okay. Data reduction. So you're going to reduce data down to meaningful parts. You're going to select, focus, and simplify the data from field notes or transcripts. That's what data reduction is. And it's important to use direct quotes to support the study's findings. So when analyzing and interpreting the data, you're going to identify those themes, patterns, and relationships that represent what was most said.
You said reduce it down to meaningful parts, and then I got the last part where you say use direct quotes to help support it, but what was the middle part?
The middle part is select, focus, and simplify data from the field notes or transcripts.
Thank you.
You're welcome. So this is pretty much the part that you're going to have read through everything, and you're going to come to your aha. 4 themes that emerged in this research study were 1, 2, 3, and 4. So for example, in the teen dating article, just glancing at this question quickly, 4 things that they described are 4 themes were describing teen dating violence, increasing the risk, why the violence occurs, and prevention of teen dating violence. So after doing all of their interviews, that's what was the 4 most common things that came out of that. So you want to verify the conclusions of your data. So you do this because the data is subjective, bias is a concern. The text also states values are involved in all research. It is important, however, that they are not influencing the results of the research. 10 people all said the same thing, but 1 person said the opposite. It's important to include that opposite viewpoint because it adds to the strength of the study. That is called a negative case analysis. do I want to expand on that?
So if we're gathering information from a lot of different people, and you're all saying the same thing, and yet, I come to Tom, and Tom tells me something totally out in left field. I don't want to just sweep that under the rug. I want to kind of include that in the study, but I want to explain it. Like, why did Tom interpret things in that way? Maybe because he has a different cultural perception or a different, life experience. But I want to include it. I don't want to just sweep it away, but I want to explain why there's this negative case analysis. Why is Tom saying something different than everyone else said? So that's a negative case analysis.
Thank you. So you're also going to see if you can replicate this. So when another researcher goes out and does a similar study, are they finding the same things that you are? That makes it generalizable or not generalizable to the public. And then you're going to take your data conclusions back to the participants. So after everything is condensed down, you're just going to verify, hey, this is what I'm coming up with and what I'm drawing that you have said. And you're going to verify, is that what you said or is that what you meant? Just to make sure that you have validation from the participant. So a goal in qualitative research is to establish trustworthiness. This is accomplished when the researcher presents his or her findings in a narrative format with raw data illustrating themes. This thick and raw data is essential in demonstrating the rigor of the research. So we want to meet 4 criteria, and that's credibility, transferability, dependability, and confirmability. Credibility and transferability are the most often used. Audibility is the accountability is judged by the adequacy of information leading to the interpretation of the findings. We're going to talk about each of these a little bit more in depth, not too much on the upcoming slides. And then fittingness also, You will know enough about the lived experience being reported that you can decide whether it rings true and is useful in application to practice. So whether it fits with everything. I'd be doing much better if I was talking about congestive heart failure, just so you let me know. Coronary artery disease, anything like that. So, all right, so credibility. Credibility is the steps in qualitative research to ensure accuracy, validity, or soundness of the data. If you see these things in the study, all of these things listed here on the slide, those are good things. Did you have training of the interviewers? Was there a peer debriefing? Was there member checks, meaning that you went back and validated that data? Did we include a negative case analysis, as Krista explained? And are you using those direct quotes from the study participants? I just mentioned this before, but again, transferability is if we can generalize this to another group of people. Are the studies applicable outside the study situation? It also looks at who was included in the study and did they include a good sample of participants. Transferability refers to the degree to which the results of qualitative research can be generalized or transferred to other contexts or settings. From a qualitative perspective, transferability is primarily the responsibility of the one doing the generalizing. The qualitative researcher can enhance transferability by doing a thorough job of describing the research context and the assumptions that were central to the research. The person who wishes to transfer the results to a different context is also responsible for making the judgment of how sensible the transfer of data is. Again, and that's talking about fittingness, is if it fits to the study that's being looked at. Dependability, again, is right here. Consistency in the findings over time. It's very similar to reliability. It shows that enough observations were made. to show consistency. Confirmability is the rigorous efforts by the researcher to be objective and maintain an audit trail to document their research process. And again, you're doing this through those member checks, peer debriefing, audit trail, self-reflections in a journal. So you're going to use this table in our assignment that we're working on later today. And this will help you in the are the results valid section. Were there things present or not present? How do I apply these results to practice? And their transferability, like were the participants representative of the general population? So you're going to refer back to this chart when you are working on your assignment. So there are 4 major types of qualitative research. I cannot say this word for the life of me, and Chris has corrected me every time that we meet together. Phenomenological. All right, I'm close. Grounded theory, ethnography, and historical. We are most likely to see the first one and grounded theory. So any of you that have the textbooks, this is in your textbook. This is a great reference to determine what type of study should be done for a particular topic of interest. And this will also be on the quiz, okay? So you're going to use it by going straight down on the arrows. You're going to start at the top, and again, going down. So if you're interested in learning cultural patterns, then you're going to choose the ethnographic method. And you may pose a question that begins, how does this cultural group express their pattern of blah, blah, blah. Okay? So you're going to, don't go from side to side, just read the columns straight down. So that first one, the second one is the grounded theory, and so forth. So since I can't say it, we're just going to skip over it. And it is the focus of lived experience. This method is chosen when you're studying a dimension of day-to-day existence for a particular group of people. So, for example, nurses who work on a med-surg unit or in a nursing home. If you want to know about their experiences, you're going to study that exact group of people. So the research question asks about some sort of human experience. For example, how do AP/NN students cope with the stress of nursing school? So I could sit down with each one of you, or less than 30 of you, and come up with the 4 themes that are the most common. As a researcher, again, I need to put aside my biases, prejudices, theories, philosophies, religions, and sometimes even common sense, and accept a phenomenon for what it is. Bracketing is also used in this type of research, and it's used to mitigate the potentially deleterious effects of preconceptions that may taint the research process. Can you talk a little bit more about bracketing?
So if you're doing some research, and let's say that your population is, I don't know, pick a population that's, could be construed as controversial. Trump supporters. What? Trump supporters. Valid. What? Say again?
Child abusers.
Okay, that's a good one. Let's say that we're trying to understand the meaning behind, child abusers and what goes through their head, like what drives them to, participate in this behavior. Well, I might have a preconceived notion like, I want to strangle this guy or, whoever it is, but you want to kind of set aside your own biases, right? So that's what bracketing is. And it's kind of acknowledging your own bias and kind of documenting that, all right, and putting that aside so you can actually get the subjective data. kind of a rough example, but does that make sense? When you're kind of dealing with a controversial type of, subject or participant?
So is the bracketing actually just documenting your bias?
Yes.
Okay.
Yep.
Next is grounded theory, which is an inductive approach to involving a systematic set of procedures to arrive at a theory about social processes. So, for example, what is the process that someone goes through in the decision making to begin hospice care? What were all of the things that brought them to making a decision to put a family member into hospice care? So it's about the process. So another example, this might not be the best example for new nurses or people getting ready to start, but I thought this was a good example about learning about a process that I found. So I found a 2017 study, and it was a grounded theory study on the intention of nurses to leave the profession. These researchers looked at the process or reasons why nurses choose to leave bedside nursing. So what can we learn from this, and what benefit can result? Because we want to fix those things. People are leaving. We don't want nurses to leave. So they completed this research study to say, what can we do to prevent nurses from leaving the bedside? So the findings of the study provide useful information about the needs of nurses for overcoming the intention to leave. The identification of this process can help in recognizing emerging problems and providing solutions to them. So that helps me understand the process a little bit more, because I thought about it myself. You hear about nurse burnout and that sort of thing, and when they get there. So it kind of was a real life example to me as a nurse of, I don't want to get there, and what are the healthy things, or what things should I look for in an institution or a hospital that I want to work for to prevent that from happening. So it kind of helps me understand the process of grounded theory a little bit better. Sorry, it wasn't the best sample for a new nurse. All right, so next. So there's usually very limited literature review to identify gaps when you're going into a grounded research theory method, because you don't want to put bias. So when you're looking at the data out there, you're only doing a very limited literature search, because you don't want to learn too much where that might guide your research more than learn from it. You will complete a comprehensive literature review, though, at the end of your research. Theories will emerge directly from the data and not previous research. I think this is a pretty interesting one of all of them. I had to do an assignment on this one in grad school, and so I was assigned ethnographic method. And it was kind of interesting because you got to explore a specific culture. So it reminded me of thinking about someone going away to another country and just living in that person's environment and picking up everything that you can from that, or going to some tribe. I don't know if that's kind of what I imagined. And, just seeing what their cultural views are, the reasons why they choose various things, food, diet, religion, all that sort of stuff. So ethnography is the study of people and the exploration of that cultural phenomenon. You include customs, beliefs, and the behaviors are based on and collected. Your behaviors, you collect that all through field work by immersing yourself into the culture. You can also do this. You don't have to go to another country to do this, but you can also do that by observing the culture of a hospital unit. When you are coming into your clinicals, there's very different, you can walk onto a floor and realize the culture of the unit can be very different from even within the same hospital. So that is a different way to this type of research is important to nursing because the world of a patient includes both cultural, political, economic, and social dimensions. So it allows you to learn and show respect and appreciation for others. So key informants are people who have special knowledge, status, or communication skills and are willing to teach the ethnographer about the phenomenon. So not everyone might be open to participating. If you go get in, if you're going into another population, whether that's on a hospital unit or in another country, not everyone might be willing or want to interact. So you're going to have key informants that are those people that are willing to share their experiences. And they may be different than the people that are unwilling, so you have to keep that in mind. So immersion into these cultures can take months or even years. And that's one reason that this type of research is not necessarily done frequently, because it's very time consuming, as you can imagine. So next up is historical research. And this is where you would see most of it done through artifacts. So you're looking through old journals, data, and you want to do this to understand the past through collection, organization, and the critical appraisal of those facts. The journals are used to give eyewitness accounts of whatever that phenomenon that you're studying is. Lusk used this method to study nurses who cared for patients with cancer between 1920 and 1950. Are we logged in here? Okay. So if a nurse researcher wanted to explore how different cultural groups utilize social media, which qualitative research method would be best to use? Has everyone had a chance? I think it looks like everyone. Ethnography. We're looking at those cultures that we just talked about. All right, next one is if a nurse researcher wanted to understand the lived experiences of parents with a child that was newly diagnosed with autism, which qualitative research method would be best? And it's my favorite word, phenomenology. I don't know why that's so difficult for me. So in all of this qualitative research, what we're really looking at is clinical meaningfulness. What are we going to obtain from these qualitative research and interviewing people and learning from them? What can we learn from them? So Chris, I didn't find this, but Chris found this awesome graphic, which I think is hilarious. But it helps us know, how do you break down the data into meaningful info? 150 kilogram mass is approaching your head at 45.3 milliseconds, or look out, What is the main point that you're trying to get across, and how are you breaking down that data so that it's meaningful to another person? What? Yeah, go ahead.
So I just wanted to kind of drive this home for you guys too, because when you're reading these papers and there's a lot of technical information in there, you're going to understand it, but a layperson may not. So when you're looking here, you've got hard data. Like a 1,500 kilogram mass is coming towards your head at 45.3 meters per second. Great, that's a lot of hard data. But now, how do I operationalize that? Okay, so as a nurse, I'm going to operationalize it by saying, get out of the way, because there's huge things going to crush your head, okay? So that's the clinical meaningfulness of that data. Okay, so when we're talking about that clinical meaningfulness, how do you take that data and what you've learned and apply it in your practice as a nurse? Okay? Does that make sense? So you got to kind of bridge that gap. Thank you.
All right, so we are going to go back to the question of the day. Everyone want to take that out? Have your thoughts changed on what you first thought the answer was, opposed to kind of what we've reviewed today? Everyone have a second to do it? So the question of the day was, qualitative research is used in all of the following circumstances except A, it is based on a collection of non-numerical data such as words and pictures. B, it is often used with small sample sizes. C, it uses the inductive method. Or D, it is typically used when a great deal is already known about the topic of interest. D, yes. So we are completing qualitative research because there's not a lot of research out there and we want to learn more. Awesome. I want you guys just to take a second, and on the back of yours, these are just for me. I would like you to write one thing that you learned about qualitative research today, if I hopefully at least got 1 point across to you. And also, if you have just even general comments about myself or what I could improve on the lecture, because I truly believe in feedback. I take things pretty well, and I like to improve on things. So I would really appreciate it because you guys have been awesome for my very first lecture on content that I'm not 100% comfortable with. So I hope that I've gotten across to you on most of it. We are going to start transitioning into the in-class assignment in just a second. So Chris is going to go over, I think it's our last slide. Or where did it go? That one. Is that the one? Okay. All right. So I'm just going to come around and grab those slips of paper. I appreciate you guys being so kind to me. And since I'm a student and I know how hard it is to be out there, I'm hoping to use distraction. So I brought candy because candy's always a good thing as a student. So, and I hope you guys love your careers as a nurse because honestly, it's the best job ever. It really is.
So round of applause for Katrina. Okay, so hopefully everybody's figured out in their groups which article you like, you read it, hopefully you're ready to go. If you did, you're going to cruise through this assignment, you're going to get out of here early. If not, you might be here till 5. So I want to talk real quickly, give you some guidance in terms of this assignment. All right? So these are basically from the 6 questions that you're going to answer. Okay? So question number 1 is asking about the phenomenon of interest. You want to look at the beginning of the article or the introduction. That whole area is your phenomenon of interest. Okay? And there should be supporting information in there. So for example, the teen dating violence. Who read that article? Okay. So they talk about it being a major current public health issue. It's even more prevalent during pregnancy and parenting. Okay? They talk about developmental tasks of the adolescent period, huge hurdles for adolescents, even more complex when teens confront pregnancy and parenting, might predispose them to violent relationships. That's all supporting information. All right? Another kind of guideline. There are 6 questions. Address every part of every question. Okay? And so it's a 60-point assignment, which means that each question is 10 points. That also means that if you write 2 sentences for a question, are you going to get full credit? Hard no. Okay? Not at all. So there should be a good paragraph or so, okay? Because there's a lot of information there. Okay, design of the study. That's given to you right in the abstract. Okay? Who read the PICU one? Yeah, it was a good article. So they talked about it being a qualitative design based on Van Manen's interpretive phenomenological approach. So look at the aim and objective in the abstract. All right, that'll give you that information. And then when it's asking was it appropriate to answer that question, think about the four kinds of qualitative research. Did they use the right design to answer that question? Okay. Now, phenomenological studies, all I want you to do is key in on those key words. And actually, I'm going to go back to this real quick. Okay, so guys, take out the key words. When you see something about lived experience or human experience, I want you to immediately think phenomenological method. Grab those keywords, okay? When you see something about cultural something, you immediately start thinking ethnography. All right? If you hear something about social processes, you're automatically thinking grounded theory. That's the connection I want you guys to make. All right? So grab those keywords and just make those connections. Okay? Okay. What's that? Yes. Yeah, so when you guys are answering these questions, when you guys are answering these questions, you can literally label them A, B, C, D. Okay? Doesn't have to be like a formal paper or anything like that. Just make sure you hit every point. And we're all going to be circulating around to make sure you're on the right track. Give me feedback in real time. No. That's pretty straightforward. That's like a 1 second. Yeah. All right, everybody ready? All right, break out into your groups. No, it wasn't bad at all.